If your breath smells like this, your body may already be in danger. If your bad breath has any of these odors, be sure to see a doctor. Halitosis, or bad breath, is a common problem. We often attribute it to poor oral hygiene, certain foods, such as onions and garlic, or morning breath. However, if bad breath becomes persistent and does not respond to conventional treatments, it may be a significant sign of underlying health issues, sometimes very serious. Ignoring such symptoms can lead to delays in diagnosis and treatment of serious conditions. Dr. Anna Orlova, a general practitioner and disease diagnosis specialist in Russia, explains 7 warning signs. Dangerous breath odors. 7 warning signs. 1. Acetone smell. Fruity, sweet. If your breath smells like acetone, it is a very concerning symptom that requires urgent medical attention. What it means? This is a characteristic sign of decompensated diabetes mellitus, specifically diabetic ketoacidosis. Why it occurs? In severe diabetes, most often type 1, but also in critical situations of type 2, when the body cannot use glucose for energy due to lack of insulin, it begins to break down fats. The breakdown products are ketone bodies, one of which is acetone. Accumulation of ketone bodies in the blood makes it acidic, which is life-threatening. Other symptoms: intense thirst, frequent urination, general weakness, nausea, vomiting, abdominal pain, confusion, drowsiness. What to watch for? If a person with diabetes or suspected of having it has a strong acetone smell from the mouth, it is an emergency requiring hospitalization. 2. Ammonia odor. Urea, fish, mold. This is an extremely serious symptom indicating kidney problems. What it means? Ammonia smell from the mouth is characteristic of chronic renal failure. Why it occurs? Kidneys are responsible for removing toxic metabolic waste products, especially urea, from the body. In kidney failure, they cannot perform this function. Urea accumulates in the blood and is partially excreted through salivary glands, where it breaks down into ammonia, giving the breath a characteristic urine or fish odor. Other symptoms: swelling, especially around the eyes in the morning, then in the legs, high blood pressure, weakness, fatigue, loss of appetite, nausea, skin itching, changes in urination, decreased or increased volume. What to watch for? Persistent ammonia smell from the mouth combined with swelling and constant fatigue. Measures: immediately consult a doctor or nephrologist. Blood tests, creatinine, urea, and urine analysis are needed to assess kidney function. 3. Rotten egg smell, hydrogen sulfide. This odor indicates serious stomach or esophageal issues. What it indicates? The smell of hydrogen sulfide, rotten, like spoiled eggs, is typical of food stagnation in the stomach or impaired digestion. Common causes: chronic gastritis with decreased acidity, atrophic gastritis, stenosis or narrowing of the stomach, or atony, loss of tone of the stomach, reflux esophagitis, stomach or duodenal ulcer. Why it occurs? When food stagnates and hydrochloric acid production is insufficient, food begins to ferment and rot directly in the stomach. Bacteria break down proteins, releasing hydrogen sulfide, which causes the characteristic rotten smell. Other symptoms: belching with a rotten taste, heaviness in the stomach after eating, nausea, heartburn, epigastric pain, loss of appetite, epigastric pain. What to watch for? Constant rotten egg smell combined with dyspeptic symptoms. Measures: consult a gastroenterologist. Gastroscopy, possibly including tests for Helicobacter pylori, and pH testing will be required. 4. Sweet liver-like smell. This is also a very dangerous odor indicating serious liver problems. What it means? A sweet, liver-like, sometimes musty or rotten sweet smell suggests severe liver damage, such as cirrhosis or liver failure. Why it occurs? The liver is the primary detoxification organ. When it is severely damaged, at example cirrhosis, hepatitis, or liver failure, it cannot remove toxic substances like mercaptans, which accumulate in the blood and are exhaled through the lungs, giving the breath a characteristic sweet, rotten smell. Other symptoms: jaundice, or yellowing of skin and eyes, skin itching, ascites, abdominal swelling due to fluid, leg swelling, weakness, fatigue, altered mental state, hepatic encephalopathy. What to watch for? If a person with known liver disease, or without, but with the above symptoms, develops a sweet liver-like smell from the mouth, immediately consult a gastroenterologist or hepatologist. Blood tests, liver function tests, bilirubin, albumin, and abdominal ultrasound are necessary. 5. Acidic smell. This is the most common extraoral odor, indicating increased stomach acidity or esophageal problems. What it means? Acidic smell may be a sign of hyperacid gastritis, gastritis with high acidity, gastroesophageal reflux disease, GERD, stomach or duodenal ulcer. Why it occurs? Excess hydrochloric acid in the stomach or reflux into the esophagus and mouth causes a sour smell. Other symptoms: heartburn, belching with sour food, epigastric pain, often hunger or nocturnal pain, discomfort behind the sternum, cough, sore throat. What to watch for? Persistent acidic smell combined with heartburn and belching. Measures: consult a gastroenterologist. 6. Disgusting, heavy, unpleasant smell, like dead meat. One of the most alarming odors, indicating pus-forming processes or tumors. What it indicates? The foul, heavy, dead smell may be a sign of upper respiratory diseases, chronic tonsillitis, purulent tonsil plugs, chronic sinusitis, sinusitis, frontal sinusitis with purulent discharge, adenoitis, lung diseases, bronchiectasis, lung abscess, lung cancer, especially with tumor necrosis, gastrointestinal diseases, advanced stomach or duodenal tumors with caries, and intestinal obstruction. Why it occurs? Tissue decay or active proliferation of putrid bacteria in abscesses or tumor necrosis produces mercaptans, indole, and skatole, and other foul-smelling compounds. What to watch for? Very strong, persistent, rotten smell that does not improve with oral hygiene. Measures: see a doctor immediately. This requires thorough diagnostics, ENT examination, sinus X-ray, chest CT, and gastroscopy. 7. Fecal odor, stool. This is an extremely dangerous symptom, indicating very serious conditions. What it means? Fecal odor from the mouth signifies intestinal obstruction or hepatic coma. Why it occurs? Intestinal obstruction, when the intestines are completely or partially blocked, their contents stagnate, ferment, and their products are absorbed into the blood and exhaled through the lungs. When hepatic coma, in extreme liver failure, the liver stops detoxifying toxins, including protein breakdown products, ammonia, mercaptans, which accumulate and give the breath a fecal smell. Other symptoms: for intestinal obstruction, severe cramps, absence of stool and gas, multiple vomiting episodes, sometimes with feces, bloating. For hepatic coma, deep consciousness impairment, jaundice, ascites, the sweet liver smell, tremors. What to watch for? This is an emergency. If you or someone nearby has fecal odor from the breath accompanied by severe abdominal pain, vomiting, or altered consciousness, call emergency services immediately. This is a life-threatening condition requiring urgent hospitalization and surgery due to obstruction, or intensive care due to hepatic coma. Doctor's advice: do not try to mask the odor with chewing gum or sprays. Consult a specialist. Steps to take: visit your dentist. First, rule out dental causes of halitosis. Your dentist will examine your mouth, identify cavities and gum disease, check your fillings and dentures, and recommend proper hygiene. Consult a doctor or gastroenterologist. If dental causes are ruled out, the next step is gastrointestinal examination. Do not ignore accompanying symptoms. Bad breath is rarely the only sign of a serious illness. Always pay attention to additional signs: weight loss, fatigue, pain, bowel changes, thirst, swelling, jaundice,